Hello, Dr. Haresh Mahajan. It's lovely to have you at the 8th edition of the CAHOCON event
Wonderful being here.
at the Vishwa Bangla Convention Center in Kolkata. So my first question would be, as the founder and managing director of Mahajan Imagining and leading diagnostic center in India, what innovative technologies and diagnostic modalities have you implemented to improve accuracy, efficiency, and patient experience in medical imaging?
Mahajan Imaging and Labs has been around for over 32 years, and we have always tried to look at practical technology and getting the latest state-of-the-art technology, which actually makes a difference in getting the correct diagnosis and also helps the clinician in giving the right treatment. So this is a targeted approach. We have been at the forefront and have introduced many new technologies into this country, including in the early 90s, a superconducting MRI system, then functional MRI system for the brain way back in 1997, getting a CT, a cardiac CT machine in 2004, getting a CBCT, dental CT machine in 2010. Again, if you see, they had an impact. With the CBCT, the implants became very easy. With functional MRI systems, we were able to give diagnosis and help surgeons with brain tumors. With CT angiography machine, we were able to pick up early coronary artery disease. And then we had a standing MRI system where you could do weight-bearing MRI of the spine, of the joints, again translating into better patient care, better clinical outcomes, better understanding of disease processes. And we have also at the same time looked at integrating various diagnostic tools, be it pathology, blood test, histopathology, cytopathology. We brought in genomics and of course nuclear medicine and radiology. So basically in our centers we do everything from hemoglobin all the way up to next gen sequencing, and from X-ray all the way up to PET CT and everything in between. And our attempt has also been to try to foray into new areas of research and be able to develop solutions for India, within India, and maybe later take them to other parts of the world.
Thank you, sir. It was lovely. My second question would be, how can platforms like CAHOCON and facilitate meaningful exchanges and partnerships among the healthcare stakeholders, including diagnostic centers, policymakers, researchers, and industry experts, to address common challenges and drive collective progress in the healthcare delivery?
CAHO and its flagship event, CAHOCON, actually is unique that it brings together clinicians, diagnosticians, hospital and diagnostics administrators, CXOs, CEOs, policymakers of the government, all together under one roof. And at CAHOCON, there is close interaction that happens amongst the stakeholders. This initiates new discussions. Ultimately, in India, we know that access to healthcare, and especially access to affordable healthcare, is something which has been a big problem. There is quite a non-uniformity of availability of healthcare, much better in the urban areas, much lesser in the rural areas, and even in tier 2, tier 3 cities. So here, when we interact with each other, we can look at opportunities, we can look at learning from each other, we can look at the gaps that are there, we can look at policy initiatives which can be made to fill those gaps. And things don't end just with CAHOCON. those relationships which are forged then are taken forward, and one-on-one interactions happen, meetings happen. CAHOCON is a facilitator of discussions which ultimately will lead to transforming of healthcare in the years to come, so that we can achieve the goal of universal healthcare that the government has set out for itself coming in the future. Also, this is one place where private players meet. So really private partnerships, and private and public and government partners meet, the public-private partnership. And without these collaborations, without these partnerships, it will be tough for India to achieve universal healthcare. And CAHOCON is actually a facilitator of these conversations, which will ultimately lead to development of healthcare systems which can provide that universal healthcare. Thank you.
Thank you, sir. And my last question would be, as one of the prominent speaker at the CAHOCON event, how was your overall experience?
I think CAHOCON in Kolkata, in this beautiful convention center, with over 1,000 delegates packing the hall, I think it's a tremendous experience. It is a learning experience. Also, I look forward to interacting with so many of the stalwarts of healthcare, as well as the delegates who are here, so that we can learn from each other. It's immaculately designed conference. The content is very, very strong, as well as the attendance here augurs very well for future CAHOCONs. And I wish the organizers, I wish to thank them, firstly for organizing this in such beautiful surroundings, and secondly for having put together such a wonderful program and bringing so many stalwarts on one stage in these 2 days that we have CAHOCON.
Thank you, Harsh, sir. It was amazing to have you here at this event.
Thank you very much.
Thank you.